Part 1. Imagine checking your mailbox one morning and finding a letter that could affect your benefits if you fail to respond on time. Now imagine that while some people are worried about protecting the benefits they already receive, millions of others are unknowingly missing valuable healthcare services that have been available to them all along. These two situations may seem completely unrelated, but they share one important connection. Both involve programs that many Americans rely on every day, and both can have a significant impact on financial security and overall well-being. In today's discussion, we're going to break down an important review process affecting certain Social Security beneficiaries and reveal a Medicare benefit that many people have never used despite being eligible for it year after year. If you or someone you know receives Social Security or Medicare, the information you're about to hear could help you avoid costly mistakes and take advantage of opportunities that might otherwise go unnoticed. Many people assume that once Social Security benefits begin, everything simply continues without interruption. While that is generally true for retirement beneficiaries, some Social Security programs include periodic reviews designed to verify ongoing eligibility. These reviews are a normal part of the system and should not automatically be viewed as a cause for concern. However, understanding how they work is extremely important because responding correctly and on time can make a major difference. One of the most important review processes involves disability benefits. Individuals receiving Social Security disability insurance, commonly known as SSDI or Supplemental Security Income Based on Disability, may be subject to what are called continuing disability reviews, often referred to as CDRs. These reviews are conducted to determine whether a beneficiary continues to meet the medical requirements necessary to qualify for disability assistance. It is important to clarify something right away. If you receive Social Security retirement benefits because you have reached retirement age, these disability-related medical reviews generally do not apply to you. Retirement benefits are not based on medical eligibility, so they are not subject to the same type of review process. However, if you receive disability benefits or have a family member who does, paying attention to these reviews is extremely important. Over the past few years, administrative efforts have focused on improving efficiency and reducing delays within various government programs. As a result, more disability review cases are moving through the system. Individuals who have not heard anything regarding a review for a long period of time may eventually receive notices requesting updated information. For some beneficiaries, this may be the first review they have encountered in years. Receiving a review notice does not mean benefits are ending. In fact, one of the biggest misconceptions surrounding disability reviews is that the letter itself signals an immediate loss of benefits. That is simply not the case. Most review notices are requests for information. The agency wants to understand whether a person's medical condition remains consistent with the requirements of the disability program. Typically, beneficiaries may be asked to provide updates regarding their medical treatment, current health status, work activity, if any exists, and changes that may have occurred since the last review. Medical records often play a central role in this process because they provide objective documentation regarding a person's condition over time. One of the best things a disability beneficiary can do is maintain consistent medical care when medically appropriate. Ongoing treatment creates documentation that helps establish a clear picture of a person's health. Doctor visits, specialist evaluations, treatment plans, diagnostic testing, therapy sessions, and prescription records all contribute to understanding how a condition affects daily functioning. When reviewers evaluate disability cases, one of their primary questions is whether medical improvement has occurred. If records show consistent symptoms, ongoing treatment, and continuing limitations, those records can provide important evidence regarding the current status of the condition. On the other hand, long gaps in treatment may create questions that require additional clarification. That does not mean every missed appointment automatically creates a problem. Life circumstances can affect access to healthcare in many ways. However, maintaining appropriate medical documentation whenever possible remains one of the strongest ways to support a disability claim during a review process. Another critical factor involves understanding deadlines. Government correspondence often includes important timelines that beneficiaries must follow. Some notices require responses within specific periods, while others explain appeal rights and procedures. Ignoring official mail or delaying action unnecessarily can make situations more difficult to resolve later. Many experts recommend opening and reviewing all correspondence from government agencies promptly. Even if a notice appears routine, it may contain information requiring attention. Staying organized and maintaining copies of important documents can help beneficiaries respond quickly when necessary. The frequency of disability reviews varies depending on the circumstances of each case. Some conditions are considered more likely to improve over time, while others are considered permanent or unlikely to show significant improvement. Because of this, review schedules are not identical for every beneficiary. Individuals with conditions expected to remain stable for many years may experience less frequent reviews. Others whose conditions have a greater possibility of improvement may undergo evaluations more often. The goal is to ensure that benefit eligibility remains consistent with program requirements while recognizing that medical conditions can change over time. For many people, the review process feels intimidating simply because it involves uncertainty. Nobody enjoys receiving letters requesting additional information, especially when benefits play an important role in household finances. However, understanding the purpose of these reviews can help reduce anxiety. In most cases, the process is designed to gather information and evaluate current circumstances rather than create unnecessary obstacles. Keeping personal records organized can also make the process much smoother. Important medical documents, healthcare provider contact information, medication lists, treatment summaries, and copies of previous correspondence may all prove useful if questions arise during a review. While disability reviews affect a specific group of beneficiaries, there is another topic that impacts a much larger population, and surprisingly, many people know very little about it. Millions of Medicare beneficiaries have access to preventive healthcare services that can help identify potential health concerns before they become serious problems. Yet a significant number of eligible individuals never take advantage of these services. One of the most overlooked benefits available through Medicare is the annual wellness visit. Despite being available to many beneficiaries, countless people have never scheduled one. Some are unaware that it exists. Others assume it is simply another name for a traditional physical examination. In reality, the annual wellness visit serves a unique purpose focused on prevention and long-term health planning. Unlike a traditional physical exam, this visit is designed to help create a personalized health strategy. During the appointment, healthcare providers review medical history, discuss current medications, evaluate health risks, and identify preventive measures that may support future well-being. The goal is not simply to address current symptoms, but to look ahead and identify potential concerns before they become more serious. This preventive approach is one of the reasons healthcare professionals place such a strong emphasis on wellness visits. Early awareness often creates opportunities for intervention, monitoring, lifestyle adjustments, and treatment strategies that may be far more effective when implemented sooner rather than later. Many beneficiaries are surprised to learn how comprehensive these discussions can be. Providers may review family health history, assess risk factors associated with chronic conditions, discuss mobility concerns, evaluate safety issues, and explore preventive screening recommendations based on age and medical background. The visit also creates dedicated time for conversations that often get pushed aside during appointments focused on immediate medical issues. Questions about long-term health goals, prevention strategies, and future healthcare planning can receive attention that might otherwise be difficult to fit into routine office visits. Another important component of preventive healthcare involves assessing risks associated with aging. As people grow older, certain health challenges become more common. Identifying those risks early allows individuals and healthcare providers to work together on strategies designed to maintain independence, mobility, and quality of life. One area that receives particular attention is fall prevention. Falls remain one of the leading causes of injury among older adults and can have serious consequences. A single accident may result in fractures, hospitalization, rehabilitation, and reduced independence. Fortunately, many risk factors can be identified before a fall occurs. Healthcare providers may discuss balance issues, walking difficulties, vision concerns, medication side effects, and environmental hazards that could increase fall risk. Even relatively small adjustments can sometimes make a significant difference in safety and confidence. The annual wellness visit also encourages discussions regarding daily functioning. Understanding how a person manages routine activities provides valuable insight into overall health and can help identify areas where additional support may be beneficial. What many people do not realize is that preventive healthcare is often most effective when nothing appears to be wrong. Waiting until symptoms become severe may limit options. By identifying risks and concerns early, individuals gain more opportunities to make informed decisions about their health. One of the most valuable aspects of preventive healthcare is the opportunity to identify concerns before they develop into larger problems. Many serious health conditions do not appear overnight. They often progress gradually with subtle warning signs that are easy to dismiss or overlook. This is why preventive care has become such an important part of modern healthcare. Instead of waiting for symptoms to interfere with daily life, healthcare providers focus on recognizing potential risks early, when there may be more options available for monitoring, treatment, and planning. A perfect example of this approach involves cognitive health. Memory and thinking abilities play a critical role in everyday life, yet many people assume changes in cognitive function happen suddenly. In reality, cognitive decline often develops slowly over time. Small changes may occur months or even years before major concerns become obvious. A person may begin forgetting appointments more frequently, misplacing important items, struggling to remember recent conversations, or finding it harder to concentrate on tasks that once felt simple. Individually, these experiences may not seem alarming. Everyone forgets things from time to time. However, when certain patterns begin appearing more often, they can provide valuable information about overall cognitive health. This is one reason cognitive assessments have become an important part of preventive healthcare discussions. The purpose of cognitive screening is not to create fear or anxiety. It is not designed to immediately diagnose a serious condition. Instead, it provides healthcare providers with a better understanding of how memory, attention, reasoning, and other mental functions are performing. These assessments are typically straightforward and are intended to identify whether additional evaluation may be beneficial. Early awareness can make a tremendous difference. When cognitive concerns are identified early, individuals and families have more time to gather information, explore available resources, discuss future plans, and consult healthcare professionals regarding possible next steps. Even when no concerns are identified, establishing a baseline can be useful for future comparisons and provide peace of mind. Another important benefit of preventive visits is the opportunity to review emotional and mental well-being. Physical health often receives the most attention, but emotional health plays an equally important role in overall quality of life. Stress, anxiety, depression, loneliness, and social isolation can affect people of all ages, including older adults. Unfortunately, emotional health concerns sometimes go undiscussed because individuals may feel uncomfortable bringing them up during routine medical appointments. Preventive visits create an opportunity to have those conversations. Healthcare providers can assess emotional well-being, discuss concerns, and help connect individuals with resources when appropriate. Mental and emotional health influence many aspects of daily living. They affect sleep quality, energy levels, motivation, social interactions, physical activity, and overall satisfaction with life. Addressing concerns early can help improve both mental and physical health outcomes. Medication reviews represent another important component of preventive care. Many Medicare beneficiaries take multiple prescription medications, supplements, vitamins, or over-the-counter products. Over time, medication needs can change. Preventive visits provide an opportunity to review current medications, discuss possible interactions, evaluate effectiveness, and identify any concerns that may need attention. Beyond the annual wellness visit itself, Medicare beneficiaries may qualify for a variety of preventive screenings designed to support long-term health. These screenings are often tailored to individual risk factors, age groups, medical history, and healthcare provider recommendations. Cardiovascular screenings remain especially important because heart disease continues to affect millions of Americans. Monitoring risk factors associated with heart health allows healthcare providers to identify concerns that may require additional attention. Early awareness can encourage lifestyle modifications and healthcare decisions that support long-term cardiovascular health. Diabetes screening is another valuable preventive service. Many individuals live with elevated blood sugar levels without realizing it because symptoms can develop gradually. Early identification allows people to discuss management strategies and preventive measures before more serious complications develop. Cancer screenings also remain a critical part of preventive healthcare. Different types of screenings are recommended for different populations based on age, family history, and individual risk factors. The goal is always the same: identifying potential concerns as early as possible when treatment options may be more effective and outcomes may be improved. Bone health is another area that deserves attention. As people age, changes in bone density can increase the likelihood of fractures and mobility challenges. Preventive evaluations can help identify concerns before injuries occur, giving individuals and healthcare providers an opportunity to discuss strategies that support strength, balance, and long-term independence. Vaccinations continue to play an important role as well. Healthcare recommendations evolve as medical research advances and public health needs change. Staying informed about recommended vaccinations helps individuals make educated decisions regarding protection against preventable illnesses that can become more serious with age. Access to healthcare services has also expanded in several ways in recent years. One of the ongoing goals of healthcare policy has been improving convenience and accessibility for patients, particularly those living in areas where obtaining appointments may be more challenging. Easier access often leads to greater participation in preventive care, which ultimately supports better health outcomes. This is especially important for individuals living in rural communities or areas experiencing provider shortages. Transportation difficulties, long travel distances, and limited appointment availability can create barriers that discourage people from seeking preventive care. Expanding access points helps address some of these challenges and allows more people to receive timely evaluations and screenings. The larger lesson in all of this is that information matters. Whether we are discussing Social Security disability reviews or Medicare preventive healthcare services, the people who benefit most are often those who stay informed and proactive. Understanding how programs work allows beneficiaries to make better decisions and avoid unnecessary complications. For disability beneficiaries, this means paying attention to official notices, maintaining organized records, and staying informed about review procedures. Responding promptly to requests for information can help ensure that reviews proceed as smoothly as possible. For Medicare beneficiaries, it means learning about preventive services that may already be available. Many people spend years eligible for healthcare benefits they never use simply because nobody explained them clearly. Taking the time to ask questions and schedule preventive visits can provide valuable insights into current health and future risks. Another important point is that preventive healthcare should not be viewed as something only necessary when a person feels unwell. In many cases, the greatest value comes when individuals feel healthy. Preventive care focuses on maintaining health, reducing risks, and identifying concerns before they become serious enough to interfere with daily life. Think about it this way. A person may feel perfectly fine while certain risk factors quietly develop in the background. Elevated blood pressure, blood sugar changes, bone density loss, or cognitive concerns may not produce obvious symptoms immediately. Preventive evaluations help uncover these issues before they become larger challenges. The same principle applies to benefit programs. Waiting until a deadline has passed or a problem has developed can make situations more difficult to resolve. Staying informed and taking action early often leads to better outcomes. Many beneficiaries are surprised to discover how much peace of mind comes from simply understanding their options. Knowing what to expect from a disability review, understanding available appeal rights, learning about preventive services, and maintaining communication with healthcare providers can reduce uncertainty and help people feel more confident about the future. Ultimately, both Social Security and Medicare were designed to provide support and security. While the details of these programs can sometimes seem complicated, the underlying goal is straightforward: helping individuals maintain financial stability and access important healthcare services when they need them. The most important takeaway is simple: open official correspondence promptly. Keep important records organized. Stay informed about available benefits. Maintain communication with healthcare providers. Ask questions whenever something is unclear, and take advantage of preventive services that may already be available to you. A single letter could contain information that requires your attention. A single preventive appointment could identify a concern before it becomes serious. A single conversation with a healthcare professional could provide guidance that improves your quality of life for years to come. Too many people miss opportunities because they never learn about them. Others face avoidable complications because they assume important information can wait. The individuals who benefit the most are often those who remain informed, prepared, and proactive. If you know someone receiving Social Security disability benefits, Medicare coverage, or both, consider sharing this information with them. A simple conversation today could help someone protect their benefits, discover a valuable healthcare service, or make a decision that positively affects their future. Thank you for spending this time with us. And remember that staying informed is one of the most powerful tools available when it comes to protecting both your financial security and your health. USA Security Check